Megan Jeon, who is a clinical psychologist, registrar, and postdoctoral research fellow here with us at the University of Sydney, working in the BRAINS program. And Megan is speaking to us this afternoon about improving care coordination for people with primary brain tumour and their families. So Megan, over to you.
Thanks, Harry, and hi everyone. My name is Megan, and I'm going to talk about care coordination for primary brain tumors, which includes benign tumors, low-grade and high-grade tumors, and some of my studies that are looking at improving care coordination. We understand care coordination is a very important process for people both receiving and providing brain cancer care. And it is about the connection between individuals, their families, and care providers to provide seamless care planning and delivery. Coordinating care that is appropriately addressing symptoms and difficulties impacting the individual and the family, and also ensures timely delivery of information and care, can reduce barriers to healthcare navigation and improve cancer treatment outcomes and overall functioning. The most common approach to care coordination in cancer care has been through designated care coordinators, who may be often nurse consultants or allied health practitioners with usually extensive experience in specific cancer types and patient navigation, who also acts as a central point of contact. And similarly, brain cancer care coordination has relied on a small number of neuro-oncology care coordinators, often located in metropolitan areas or covering a very wide regional areas. And this poses several challenges, but the most critical one is that whether people have access to a care coordinator or whether they receive coordinated and continuous care from diagnosis to beyond cancer treatment will vary greatly depending on their geographical locations, brain tumor types, and support and resources available for healthcare professionals who are involved in their care. So to address some of these challenges, we have initiated 3 research studies to lay the foundation for improved neuro-oncology care coordination. Firstly, we aim to understand additional layers, as we sort of have been hearing from other people, especially looking at those additional layers, in terms of care coordination for brain tumors, and identify components and indicators of optimal care coordination according to patient needs and care settings. And we'll look at this in our scoping review of sort of existing evidence, compiling everything that's available so far, and in a Delphi study with panels of experts, including health professionals, researchers, and also consumers. And next, we aim to understand the barriers and support needs of healthcare professionals, such as professional training needs, emotional needs, and practical support needs, sort of to boost and upskill the workforce that is involved in neuro-oncology care or care coordination. So we are conducting at the moment an interview study with healthcare professionals to understand how to better support them to do the care coordination or caring jobs. Lastly, communication and connection between hospital-based care and community care is very critical, so we can achieve a complete picture of care coordination across settings, especially by understanding current outpatient care and community support models. So we aim to do an observational study of multiple community support models, which may look like this illustration, for example. So we'll be looking at the support calls and the services or the referrals provided to an individual patients or carers. And we are sort of hoping these studies set the strong evidence base and guidance for neuro-oncology care coordination, and hopefully they will lead us to the next steps for implementation of suitable models of care coordination for different tumor types and geographical locations, boosting greater access to care coordination by supporting the healthcare professionals, and understanding areas for improved linkage and care coordination in community care settings. So thank you.